Fasting during diabetes. Do's and don't. A large number of people with diabetes follow fast irrespective of its health implications, often without proper education and medical advice. The eating and physical activity patterns during different fasts vary a lot depending upon social and cultural factors. Even eating pattern is not uniform among all persons following Navratris and is modified as per their cultural patterns. There are numerous challenges of diabetes management in India related to diet, physical activity pattern, healthcare seeking behavior, and healthcare provision. Studies show poor glycemic control and higher incidence of acute and chronic complications in Indian patients. In addition, there is lack of awareness and misconceptions about their concepts and attitudes toward diabetes, its complications, diet, exercise, drug therapy, understanding about insulin, and treatment among patients and as well their family member. Since the persons with diabetes should eat at regular intervals to maintain optimum blood glucose levels, management of diabetes is challenging for the physician during such fasting periods when people abstain from certain food items and opt to survive on others, observing a long time fasting, usually eating once or twice in a whole day. A sudden change in dietary habits can have harmful and unmanageable impacts on blood glucose levels. On one hand, it leads to episodes of hypoglycemia, and on the other hand, it results in postprandial hyperglycemia, ketoacidosis, metabolic complications, consequently leading to renal dysfunction and major comorbidities. Abstinence of water and fluids during hot weather can result in dehydration, electrolyte imbalance, and hypotension, while hyperglycemia can lead to loss of body fluids and electrolytes through excessive urination. Patients may visit their primary care physicians asking if they can observe fast and precautions they need to follow if they observe fast. Although fasting may improve health-related outcomes such as blood pressure, lipids, insulin sensitivity, and biomarkers of oxidative stress in general population. Optimum physical activity during non-fasting periods and 15 to 20 minutes walk followed by major meal, at the end of fast, is beneficial. Carbohydrates. It is metabolically essential to provide approximately 50% to 60% of the total kilocalories per day from carbohydrates. Protein. Approximately 15% to 20% of the total energy should be met from the protein to meet the daily dietary allowances. Fats. There should be a total contribution of as less than or equal to 30% of calories from fat per day. Omega-3 fatty acids have been associated with reduction in cardiovascular disease risk biomarkers in type 2 diabetes. Nuts can serve as an optimum meal during fasting, being good source of protein. Vitamin and mineral. Fruit chaat, salads, custards, ice creams, shakes, and vegetable lassi containing natural fruit sweetness and vegetables are better options of frequent in between minor meals than juices and sugary preparations. Fiber. A desirable intake of about 25 gram per 1000 kilocalories or 30 to 40 gram fiber per day should also be maintained in the days of fasting and feasting. Water and fluids. It is beneficial to include low-calorie beverages and drinks such as lemon water, green tea, lassi, chak, matha, pudina water, jal-jeera, etc., to quench thirst, especially during summer season. References. Thank you. For more health tips visit www.mycitymydoctor.com.